Hi everyone, welcome back to my YouTube channel. Today we are going to talk about inferior nasal conchae. It's a side you can see the diagrammatic representation of the lateral surface of nasal cavity, and the highlighted part you can see is the inferior nasal conchae. So let's start our topic with introduction. Inferior nasal conchae, that is also called as inferior turbinates, are pair of curled scroll-like bones located on the lateral wall of nasal cavity. Unlike the middle and superior conchae, which are part of ethmoid bone, the inferior conchae are independent facial bones. They play a critical role in air conditioning within the respiratory tract by increasing surface area and directing airflow. Talking about its anatomical structure, we will first talk about its shape and appearance. It is thin, curved bone resembling a scroll or shell. Medially, their curved edges project into the nasal cavity, creating turbulence and inspired air. Talking about surfaces and border, it has medial surface that is convex and covered with vascular mucosa. It has lateral surface that is concave, articulating with surrounding bone. Each bone has an upper border with several articulation points and a free inferior edge that project into the nasal airway. Talking about the articulation, each inferior conchae articulates with four adjacent bones. They are maxillary, that is present along its lateral base, palatine bone, that is present posteriorly at the back of nasal cavity, lacrimal bone, that is present superiorly near the nasolacrimal duct, ethmoid bone, that is present medially and superiorly where it approaches the middle conchae. These articulations firmly integrate the inferior conchae into the nasal framework. Now let's talk about the function of inferior nasal conchae. The inferior conchae serve several vital physiological roles. They are airflow regulation, as they direct and slow inhaled air to improve olfaction and respiratory efficiency. Second function is air conditioning, as they provide a large surface area that is lined with ciliary respiratory epithelium and capillary-rich mucosa. They help form, humidify, and filter air before it reaches the lung. Functions of inferior nasal conchae. Third is particular filtration. It traps dust, microbes, and allergens in the mucosal layer, aiding immune defense. Fourth is voice resonance, as it influences resonance during speech by shaping air channels in the nasal cavity. Talking about its development and ossification, it develops through endochondral ossification. Ossification begins in fetal life and continues postnatally, with their distinct shape developing early in childhood. Talking about their clinical significance, inferior turbinate hypertrophy is first one. Enlargement of conchae due to chronic allergies, infection, or irritation. It may lead to nasal obstruction, mouth breathing, and reduced airflow. Second is medical and surgical management. It is treated with nasal decongestant, antihistamine, or turbinate reduction surgery, that is maybe submucosal resection or radiofrequency ablation. Now let's talk about role in sinus health. Malfunctioning conchae can contribute to sinus drainage issue, predisposing to chronic sinusitis. Now let's compare the inferior nasal conchae with other conchae. Superior and middle conchae are part of ethmoid bone. They are smaller and more superior, while inferior conchae are separate bone with greater size and more direct influence on airflow entering the respiratory tract. Now let's talk about conclusion of this lecture video. Inferior nasal conchae may be hidden deep within your face, but they work tirelessly to fine-tune each breath you take. They are natural humidifiers, filters, and regulators that are essential for keeping your lungs clean and your nose efficient. And this was all about inferior nasal conchae. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.